so many parents are trying to deal with what happened at that school. And the Tumbler Ridge community is still grappling with the fallout of the school shooting that took multiple lives. So what kind of support does the community need to cope with this? For more on that, we've reached Alyson Jones in Vancouver. She's a registered clinical counselor and a child and family therapist. Thank you so much for making time for us today.
Thank you for having me in this very difficult time. And my heart goes out to everybody that has been impacted. And yes, it is a day of mourning here. We're all feeling it.
Now, Alyson, we were listening in yesterday to the mayor of Tumbler Ridge, to the premier of British Columbia as well, as they talked about some of the supports that have come from elsewhere in BC to the community. And one of that was a call out for counsellors. And many were deployed to this community of Tumbler Ridge to make sure there was enough support for the people who need it the most right now. Can you walk us through how that call out happens and how people, how counselors, how professionals then travel to Tumbler Ridge to be there?
Well, there's a variety of ways and a variety of organizations that want to support this community, want to support these families and children. And so, part of it is coordinating that response. But like my understanding is that Northern Health has counselors coming in. There was a call out yesterday for the Association of Clinical Counselors for people that are willing or wanting to volunteer their time. And there's also resources through Criminal Victims Assistance, which provides counseling for people that have been victims of crimes as well. So there are people stepping up, and now it's a matter of coordinating it. And I think one of the things that's important to remember here is it's not just responding to the crisis right now, it's that there is going to need to be ongoing support for these children and these families and the people that are directly impacted by this. So from a counselor's point of view, it really is much like Dennis said right now, who my heart goes to him very much, it is about being there, being present, holding space, listening, letting them speak, letting them be quiet if they need to be, but letting them feel connected to somebody else. So it's a process. There are ways to help people with post-traumatic stress. And those things will come forward. But right now we're in the traumatic stress. And it's just needing to be there and feel supported and understood.
And now, Alyson, I do want to dig deeper into what will be needed by these individuals. I want to ask you also, in terms of the process, once these counselors are deployed to the region, are they, for example, assigned to different families or to a location to be stationed there so that those requiring help can come to them? Or are there cases that are particularly assigned to individuals so that they can offer those services knowing that they will be required, the most for families, for example, who do have children who did not make it, or the educator who did not survive this shooting? How does that work to ensure that those who need help most get it?
Well, like I said, it's going to be a coordinated effort, and people are it's so fresh and new. It's still in that process. And so it'll be through different supports, agencies, volunteers, but these will all be professional counselors, people who are trained in this. And they will be assigned cases. And one of the good things we have now is, even if somebody is there supporting you and they've come in to support you, that support can continue because we can provide our services online as well. So if somebody is connected and feels supported, it doesn't mean it's just for now. It can be ongoing. And we need to be really sensitive to that with children, because this will play out, this stress, this trauma will play out at different times in different stages at different ages.
You know, we've been hearing from some officials too who have been saying this is irreparable damage, despite getting all the help and support. And it seems certainly like there is so much support descending on Tumbler Ridge that will be available to individuals there, which has been the case, we know, in so many other incidents where there have been these traumatic scenarios that have unfolded. But is it irreparable damage? Is it something that will just live with the people who experience this for the rest of their life, whether that's in the form of anxiety or fear or other sort of ways that it might manifest itself?
When you go through trauma of that level, it does become part of the fabric of your life. But I don't think I would call it irreparable damage, in the sense that humans have had to deal with very difficult and traumatic things throughout history. And it becomes part of our narrative, part of our story, part of our DNA in many ways, literally and scientifically. But it is about carrying this together, carrying this pain together. It's not about just one person being traumatized or a community being traumatized. It's about having compassion, and as a country, as a world, as a community, as a person, holding space for that other person, and knowing that I have pain, you have pain, we can hold it together. And that's what compassion truly is. And one of the things I say is we can't be immune to compassion. We can't get so hurt that we turn away from it because it's too much. Because the thing that heals us is turning towards each other and holding the pain together.
Alyson, I want to thank you so much for this conversation. We appreciate your time.
Thank you very much.
That is Alyson Jones. She's a registered clinical counselor and a child and family therapist. She joined us today from Vancouver. And a reminder, of course, of the supports that you can seek if, of course, you're watching this coverage.
Thank you very much.
And as this story is impacting you, you can, of course, call a support line, 310-6789, or also there's the Kids Help phone line. You see the number there, or you can text CONNECT to 686868. And if you are in crisis, call 988. Stay with us. We're back in a moment.